Hi, good afternoon, Dr. Charlie Lim. My name is Raymond Yeo Wang Jie, and my BCU student number is 2412795, and my Kaplan student ID is CT0308802. And today I'm going to talk about my presentation on innovative thinking for organization development module. And this topic is on how we might improve mental health and well-being. The the problem statement here is the post-COVID pandemic has dramatically transformed workplace mental health awareness, and lingering pandemic-related anxiety to continue to shape employee psychological well-being, and companies are increasingly prioritizing mental health support strategy. So over here, right, this is the statistics shown, and the increased number of mental health issues faced, prevalence to poor mental health increasing in Singapore. Young adults have high proportion of 25.3%. Depression, anxiety, and stress. There are 1 in 3 youth in Singapore reported with very poor mental health and say that Institute of Mental Health survey. And nearly about a third of young Singapore or young locals aged 15 to 35 reported symptoms that feeling empty, tense, or even upset most of the time, according to National Youth Mental Health Study, in which most of the young teenagers to mature adults are the majority facing mental health issue. And to add on to my previous slide, survey done between the end of year 2021 versus 2023. So in 2021, COVID-19 was a primary health concern among Singaporeans. But following the mental health issue, by 2023, mental health has emerged as the leading health challenge, highlighting its continued and growing significance in Singapore public health landscape. Overall, 55% of Singaporeans faced stress impacting daily lives last year, with 49% experiencing prolonged sadness and 27% having suicidal thoughts, particularly among those under 35. So, and there's a risk in employing employees with mental health concerns or history. Majority of companies and 7 in 10% or 10 people with mental health condition agree that negative attitudes of co-worker are the major barrier to employment. 65% of the company in Singapore have also introduced mental health literacy program for their employees, and 56% has begun training managers on mental health issue. Organizations face competitive pressure. Employees with good emotional well-being are better positioned to think creatively, solve problems, and build resilience, key elements that drive innovative in support working environment. In my perspective, strong mental health is crucial for creativity, problem solving, and also resilience. A positive mindset empowers us to embrace challenge as opportunity for growth, fostering innovative and risk-taking. Supportive relationship and effective coping mechanisms such as breaking down problems and also exploring creative outlets are essential for navigating setbacks and build resilience. I decided to use the 6 stage of design thinking process to deepen my understanding more concretely. So the first one is empathy, understanding employees' mental health challenge through survey, interview, and also focus group. Next, we have define. I use the uh, six step of thinking design to define the core issue, a lack of integrated proactive mental health strategy as well. Right. So next we have ideate, brainstorm innovative solution, including AI-driven tools, mindfulness workshop, and also flexible application tools. For the prototype, I developed a pilot program for mental health application and peer network. Test. Launch initiative on small scale, gathering feedbacks and also measure effectiveness. And last, implement scale successful strategy organization wide while refining based on feedbacks. Alright, so moving forward, I also add on the 5 whys as my analysis. So the 5 whys and also the root cause. The root cause lies in the ongoing challenge posed by COVID-19. including breakdown infection, reinfections, and also its long-term mental health impact, highlighting the needs for resilient and also sustainable social and mental health care service. So to deepen my understanding, I add on 5 ways to find out the problem more detailed and help me to get my ideas more precisely. The root cause lies in the ongoing process posed by COVID-19. Right? Looking back at our problem statement, the post-COVID pandemic has dramatically transformed workplace mental health issue awareness. The 5 whys method help to identify the root cause of post-COVID-19 mental health issue by breaking the problem into smaller steps. Instead of focusing solely on visible symptoms, it examines deeper factors such as prolonged stress, social isolation, and a gap in mental health resources. The root cause, okay, underlying reason for the rise in mental health care issue after COVID-19 pandemic, and also why. Okay, the first why, many individuals experiencing high level of stress, anxiety, and depression. Some even have suicidal thoughts. The next why, we have disruption to daily life, such as job loss, financially instability, reduced social networking due to isolation. And the next why, we have prolonged lockdown globally and also quarantine limits. The, the next why, we have people ability to cope. Social stigma around mental health prevents many from seeking help. And the last one, cultural norms in society taboos around addressing mental health issue. The first step of empathy, we define the challenge through survey, interview, and also focus group. To understand a little bit more, we also have concrete, uh, we have narrowed down most of the problem faced, and also what are they looking for. So they are looking for peer support and also user involvement. So increased anxiety among employees regarding of virus exposure, integration of physical health and well-being, and also these are the more on concern towards employees. Next, after that, we define the lack of mental health strategy. This is the current in the market. The mental health gateway app help people in gateway to hope program. It teaches them how to help others with mental health problem. It also gives them tools and support. Next, we also have the better help application has multiple functions and features, including messaging counselors and also different types of therapies for different age group and individual. To deepen my understanding into this app, I actually studied a little bit more in depth for this two app, and I realized that there are more functional ways we can strengthen it by adding a few more ideas inside. My solution of improving this app is to introduce a new function app called Scenery Space by adding the six stage of thinking process to develop the idea. The ideation process, I began mapping out scenery space vision through low fidelity wireframe and also hand draw each feature and user interaction by meticulously sketching the app core function on paper. After that, I discussed with some of my classmates to make up a prototype, the app, and we tried to use Lego to create an idea for an app. This is a low fidelity picture. Wireframe to add on more functionality into it. Over here, I actually add in. I realized that we're having wireframe. It actually helps me to broaden my vision for the app. And after receiving encouragement and also feedback on the wireframe and low fidelity design, I developed a more detailed mockup that demonstrates how the app would appear across various pages. So the front page of the app, okay, this is actually the mockup for the medium fidelity after discussion of the wireframe. And next one, we have the adding Siri function for consumer to communicate more efficiently. Next, we have testing app flow, medium fidelity, adding multiple function. And next, adding mental wellness, lifestyle tips, medium fidelity. Adding motivation quotes, medium fidelity. And also other function in medium fidelity, example motivation hub allows user to experience heart-to-heart talks with trained professionals such as professional psychiatrists, religious group leader, or video that encourage them by clicking on the button or using Siri. Different types of communication tools. There are message conversation, voice message conversation, or even upload pictures on message. Relaxation, explore relaxation itineraries. So give them a different offers to relax their mind and tips. Testing. So giving a different offer. Over here testing, I actually check with my I test out my prototype and I also share with my classmates along the way. After testing and changing, I finally finish up the prototype for my app. Seniority, space, high fidelity. Moving on, implementation. So this is actually a different range for mental matters. Mental mentors cater for different age group as well. Other offer different improvement tips such as mentally to physical, and also on top of that, I also introduce a little bit of like a fruit tip, lifestyles, and also for different types of wellness. Implementation. So there's a daily motivation code to help mental health victim to by encouraging them. And also the next one is additional features to encourage user to explore AI voice assistant technologies such as Siri. In here, I have two different itineraries for them. One is a 1 day itinerary for short getaway, and the other one is a 3 day getaway to actually relax their mind and also meditate as well to improve their mental health. Implementation for group or maybe in workplace wellness guide or individual workplace. Additional features to encourage user to explore using AI voice assistant technologies such as Siri or even upload pictures due to traumatic situation. Based on based on the feedback from my classmates, the app needed to be more engaging and also user friendly. Recognizing that many people experience mental health challenge at workplace may not be fully aware of their condition. I added the voice communication feature to make the app more approachable. The voice-enabled tools help users feel more comfortable checking in on their mental well-being and getting the support they need. Obstacle. So this is actually the obstacle that we are facing. Remote work issues such as digital figure, isolation, disconnection. Increased stress factor such as job security fear, heavy workload. Work-life imbalance, difficulties separating professional and so personal time. Health and social impact, COVID-19 concern or in reduced in-person interaction. So the solution here is meditation, calm, guided session, breathing exercise for stress relief and also better sleep. The next one is professional support, direct access to licensed therapists via text chat or AI assistance. Next, we have personalized AI coaching, custom motivation, and also workplace wellness guidance. Next, we have daily wellness planner, structured mental health activities, and also balanced focus scheduling. The benefits they can get is immediate support, 24/7 access to tools and also resources, access from anywhere, flexible scheduling, stress management skills, pattern recognition and self-awareness, early signs, crisis intervention when needed, better focus and concentration, and so on and so forth. These are the possible implementation challenge. So internal factors, we will need strong IT team, commitment and also support from management and company, keeping up with changes, healthcare regulation and consistent evolving. The app developer may need to stay informed or adapt as well. So the over-reliance, this app should not be seen as a replacement for human interaction or professional care. Regulatory compliance, licensing, and also regulation. It may also need to comply with various regulations related to healthcare, data privacy, and telemedicine. External factor. Addressing ethical consideration, potential for misuse, this app should not be used for diagnose or treat serious mental health condition. This app also provides and responsibility and liability. If the app provides incorrect or harmful advice, the developer may face legal or ethical consequences. Algorithmic biases, AI-powered tools can perpetrate biases if not carefully designed and trained. The app algorithm should be regulated audit to ensure they provide fair, unbiased advice. In conclusion, this project I fully utilize the 6 stage of design thinking process and include 5 wise root cause analysis to address a significant user challenge. The underutilization of the mental health support resource, many individuals struggle with mental health issues due to various factors, but social stigma often prevent them from seeking help. This app aims to inspire and encourage individuals towards a more positive outlook in life. Recognizing the substantial government investment in mental health initiatives across hospitals, school, workplace, this app can also be a valuable tool for employees to support their employees' well-being. And therefore, I finish my presentation. Thank you.